My name is Archbishop Thabo Makgoba of the Anglican Church of Southern Africa. I have been given the topic Resilience and Renewal, the role of faith in the response to HIV for the UNAIDS virtual conference. This meeting takes place in the context of the global COVID-19 pandemic, with its enormous global impact on our health, economic, and social systems, and its lasting consequences for individuals, communities, and countries that will be with us for at least the next 5 to 10 years. The pandemic not only has a direct impact on efforts to achieve the 2030 Sustainable Development Goals of the United Nations, but it threatens to derail the progress we have made so far in the fight against HIV and AIDS. We have already seen the redirection of resources to deal with the COVID-19 emergency and the disruption in prevention, testing, and treatment programs, as well as the devastating impact of job losses and food insecurity, which have mostly affected the vulnerable in our society, namely women-headed households and children. COVID-19 has intensified existing global and national lines of inequality, not only affecting access to quality of healthcare, but access to education and employment and the receipt of steady income. In the wake of COVID-19, there is one thing of which I am certain. If we simply continue to work in the same way as in the past years, we will not succeed in our fight against HIV and AIDS. We have to change our model of joint action, and especially how we establish partnerships of formal collaboration in the way national programs are planned and implemented. We have to learn to work smarter and more efficient with resources we have. We have to be more accountable and transparent in faith and government systems to curb corruption and wastage of scarce resources if we want to ensure no one is left behind. The point has been made repeatedly that the faith-based organizations play a key role in the delivery of essential services, that they are located in local communities which trust their work, that although their role is sometimes negative, for example, condemning alternative lifestyles that cause stigma and alienation, they also deliver comprehensive prevention, treatment, and support services. In 2012, Ambassador Eric Goosby told a PEPFAR consultation, and I quote, "In sub-Saharan Africa, it is estimated that 40% of health services are provided by faith-based organizations, many of which serve the most rural areas and the most marginalized people. Faith-based organizations have strong community roots and a deep reservoir of trust on which to draw. Robust participation of faith-based organizations is not optional. It is essential for an effective response to AIDS," close quote. However, there is often a lack of understanding and financial support from government and development agencies for the work of faith-based organizations. In the design of national strategic plans, NSPs, for health, faith-based contributions are often disregarded by medical and financial consultants and bureaucrats who either do not accept the overwhelming evidence that the faith-based organizations make a substantial difference in combating AIDS and HIV, or faced with a fierce competition for resources, relegate the role of faith-based organization to general advocacy and moral support programs that have little chance of receiving appropriate funding. Our experience is also that the interaction between international development agencies and national health functionaries can sometimes obstruct cooperation with faith-based organizations. For example, the argument is used that this is what the international donors want. The issue should be not what development agencies want, but what does the country need to strengthen comprehensive health system. We need to guard against falling into the trap that the response to HIV and AIDS becomes a business where only those who have inside information and special contacts and can deploy the correct jargon have a real chance of access to meaningful resources. I want to repeat what I said at the International Ahimsa Conference on Faith and Global Health, co-hosted by the National Religious Association for Social Development in 2015 in South Africa. Faith-inspired communities are willing to partner with governments, not to strengthen our own hands, but for the sake of the vulnerable and the excluded. We want to build the future together. Faith-inspired communities do not see themselves as the end, but instead exist for others. We need to have courage to move beyond fear, and that they need stamina to work collaboratively and to end inequality of opportunities, particularly around the issues of health. Faith-inspired communities are willing to partner with governments, not to strengthen our own hands, but for the sake of the vulnerable and the excluded. We want to build the future together. Faith-inspired communities do not see themselves as the end, but instead exist for others. Close quote. I was just extracting from my Ahimsa speech in 2015. There are numerous models of effective partnership between faith-based organizations, government, and international agencies across the world. Many of them documented in PEPFAR and Global Fund publications. I would like to mention a few from my own context in South Africa, as well as new statements by international scholars published by Barclay Center at Georgetown University. In South Africa, we are dealing with 4 pandemics at the same time. Firstly, HIV and AIDS. Secondly, TB, and 60% of people living with HIV and AIDS have TB, the number 1 cause of death. Thirdly, COVID-19, and finally, pandemic of poverty, unemployment, and inequality. That impacts directly on the quality of health services. But there is cause for hope, both in South Africa and internationally. The South African National Religious Association for Social Development, NRSAD, in partnering with the Global Fund and our National Health Department, has developed a health literacy program that invests in the training of faith-based healthcare workers based in local faith communities. Formal agreements between our National Department of Health and faith communities to distribute chronic medicine have made it easier for patients to access their medication. Sharing a cup of soup and stories to encourage one another add to the impact of this program. Private-public partnership in the current COVID-19 response have fostered cooperation to ensure that we have capacity to cope with infections. The integration of emergency food and health services in an initiative in the Northern Cape, including an iron ore mine, the NRSAD, local faith leaders, the National Department of Social Development, and the National Department of Health not only serve the most vulnerable families in the community, but is cost-effective and collects quality data for social and health systems. A recent Barclay Center publication builds on inputs from academics, faith communities, and faith-based organizations across the world to formulate specific challenges and targets for faith communities to strengthen their resilience in the fight against HIV, setting ambitious targets to help achieve the goal of eradicating HIV by 2030. If financial support can be given to this kind of global initiative, it will substantially strengthen the role of faith communities. A recent study of the challenges with current PEPFAR interventions has concluded that we are significant limitation in facility-based models and a growing consensus that building community-based alternative is necessary. This is in line with our National Health Department's focus and policy on community-oriented primary care. I'm encouraged by the statement this month by the South Africa's Minister of Health, Dr. Zweli Mkhize, when he emphasized, in essence, there needed to be a new way of doing things where government does not confine itself to the role of service delivery, thereby exerting control over communities, but to rather shift towards the role of facilitator and coordinator, supporting the numerous initiatives and proving networks of capacity within faith communities, NGOs, civil society, and business that have the capacity to implement such programs. And further, Minister Mkhize said, I therefore commit to championing enhanced collaboration between government and faith communities. Faith communities work at local level and have a presence in every corner of the country, including rural areas. As government, we agree that coordination between multilateral and bilateral agreements are needed to ensure streamlining and non-duplication of grant resources. Given the alternative innovative models available and the strong commitment of leaders like Dr. Mkhize, is it too much to ask, can government and international development agencies consider allocating at least 5% of their existing budgets to foster and strengthen partnership with faith-based organizations, to use that as leverage to involve private and volunteer networks in a professional and coordinated way? This could mean the difference between achieving and not achieving our 2030 goal to rid the world of HIV and AIDS. Allow me to end with another quote from my address to the Conference on Faith and Global Health I mentioned earlier. We believe that we love because our Maker first loved us. We all serve because we believe that our Maker came to serve first. Particularly in the Christian community, we believe that He came so that we may have life and have it abundantly. He came so that our spiritual, emotional, intellectual, physical dimensions of human living are catered for. All our faiths believe that God created us in His image, and we are all intrinsically valuable in God's eyes. We are all intrinsically worthy of dignity and respect, no matter what our circumstances. Thank you for your attention. May God bless you all.